Thanks for staying with us on the show. Now, the Nigerian government has confirmed that 7,202 cases of diphtheria have been recorded in 18 states across the country. The government recently set up an emergency task force to mitigate the spread of diphtheria in the country, with the primary objective being to operate in an emergency mode to prevent the further spread of diphtheria to other states and also provide relief to affected communities. Well, getting straight into this conversation, I am now joined by Oluwafemi Salau, the Senior Registrar at the Department of Internal Medicine, LUTH, that's the Lagos State University Teaching Hospital in Lagos, Nigeria. Thank you so much, Olufemi, for joining us.
Good morning, everyone.
Thank you. Good afternoon. Okay, Olufemi, going straight to it, can you let us in on what exactly diphtheria is and what the causes are?
Okay. Thank you very much for the question. Diphtheria is a highly contagious disease, also vaccine preventable, caused by the organism called Corynebacterium diphtheria. It can also be caused by another bacteria, the same family called Corynebacteria ulcerans, although that is much rarer than the former. This is highly preventable and it can occur in all ages. But it's most prevalent in children under 14 years of age. So there are groups that are highly susceptible to having diphtheria, like I said, preschool children and children under 4 years, elderly, people older than 40 years because of waning immunity, people with poor socioeconomic status, um, and most commonly, people that are not vaccinated or are incompletely vaccinated. Thank you.
Now, you mentioned that it's most prevalent in children. Why is that? Is it that their immune system is not strong enough, or what is the exact reason?
Okay. Yes, it is common in children because of the usual risk factors I say with children. Um, Children, it is more related to their immune system. So that is why it is recommended that they are vaccinated at that age. So there is a national immunization schedule of which they are to get a complete dosage of vaccination. But in this part of the world, and especially in the north, due to the apathy for vaccination and the socioeconomic status, most of the children in that, let's say greater than 50% of the children in those communities are not vaccinated. So this leads to a high prevalence of diphtheria, and if they come in contact with such.
Okay, recently the country has experienced a high number of infection and the spread of diphtheria. It didn't used to be like that. But the most troubling thing is that most people are not aware of this. A lot of people don't even know what diphtheria is. They don't know that there is the existence of something that should be guarded against. How can we create awareness about this, especially for those staying in the rural areas? And because, we know that it can be spread, through bodily contact and all that. So how do we create the awareness for them?
Okay. So the thing about diphtheria is that the symptoms are like those of all other respiratory tract infections. It's like the common flu, so you might not easily suspect diphtheria. The common symptoms include low-grade fever, that is temperature between 7.5 and 50 degrees centigrade. You can have sore throat. Some can present with cervical and lymph node enlargement. That is, you see somewhere around the neck, it's enlarged, which we call bull's neck. So some can have sore throat, which is like one of the commonest symptoms, like what you displayed on your screen here. So this organism produces a toxin which can cause inflammation around the tonsils and the pharynx. So it causes development of a patch, which can lead patient to develop dyspnea, that is difficulty with breathing and difficulty with swallowing. So the symptoms, the common symptoms of some are also asymptomatic. So the symptoms of the diphtheria are like other respiratory tract infections. But what is peculiar about it is the formation of this patch called single membranous patch around the throat. So if you try to like distort this patch, it bleeds on touch. So in a way, in order to create awareness, is just like what you do generally for other things. Um, you talk to. So it's actually difficult to create awareness about it because we have so many respiratory tract infections around it. Now that there's an outbreak, I think there should be more communication. So the Minister of Health has established a national rapid response team that comprises of the National Primary Healthcare Development Board, then the Nigerian Center for Disease Control, and other parastatals, including the HGO. So it's at this community level that you can create awareness because the National Primary Healthcare Development Agency is in charge of primary healthcare centers across the country. So, in addition with other local government health institutions, they can in a way create awareness in the community through community engagement and through community education. There's also something called vaccination, educate the community on vaccination. That is one way we can actually prevent diphtheria. Because unlike most other respiratory tract infections, if not treated, it has a case fatality of about 5 to 10%, and in children it can be as high as 40%. So education is important, and it has to be done at the community level.
Okay, Oluwafemi, thank you so much. Now, I'm going to come to what the government is doing about it, but we're going to take some facts about diphtheria right away. Now, I want you to help us understand, the creation of a task force and what has been accomplished with that. But in the meantime, this is an epidemiology of diphtheria disease. Now, it says it is a highly contagious vaccine preventable disease caused by exotoxin producing Corynebacterium diphtheria. It also spreads between people mainly by direct contact or through the air via respiratory droplets. Now, it can affect all age groups, but like you said, most, especially children. However, unimmunized children are at higher risk. It also, okay, this is the statistics of recorded cases right now in Nigeria. It says 5,299 of the confirmed cases, which is 73.6%, occurred among children from the age of 1 to 14 years, with those aged 5 to 14 bearing most of the brunt of the disease. I think this is quite similar to what you've said. And if you look at the screen, you would also see the state with the high cases ranging from Kano State having 6,185. That is a very high number, from the north. Then Yobe State, Katsina, all the way down to places like Cross River, Enugu, Imo, Nasarawa, and Zamfara State having one case each. But then we still hear that this is still spreading. So it's something that we should take precautionary measures for. Now, coming back to what I said I was going to talk about, Oluwafemi, earlier I mentioned that the government has set up an emergency task force that will help to fight the spread, maybe combat the spread, control it, and eventually eliminate the disease in Nigeria. How effective would you say that this task force has been, seeing that we still have the diphtheria spreading almost every day? Would you say that the task force has been very effective, especially in places like the north? You saw Kaduna State having over 6,000 cases.
Okay. First of all, we would like to appreciate the federal government and other and its parastatals for being proactive against this communicable, highly contagious disease. If you look at the demography of the cases of diphtheria, you can see that it is common in areas in the north, and northern Nigeria has its own peculiarities. Kano, for example, is the most populous state in the northern part of the country. You can also if you can also talk about the state of the facilities over there, the socio-economic status, security-wise, poor health, overcrowding, lack of access to vaccination, or the attitude towards vaccination, substandard living, and all other factors. So this has actually compounded the ability to take on some of these challenges in that area. However, the first task is to set up a community, a rapid response committee to take on all these problems by the federal government, which the federal government has done. So I can't really say how effective it has been over, because if you look at the outbreak from January to April, we also have the second like outbreak this year between July and now. Um, I think based on the fact that we're having a new government, we should at least give them time so that we know how effective this can be. But for me, I don't think we were fast enough to take on this disease, because there was an outbreak in January and April. We don't know how much they did about that. So this present minister, Mohammed Ali Fati, was one that set up a national committee, and the committee is to like coordinate all the agencies in charge of controlling this communicable disease. They are to be in charge of surveillance, provide laboratory facilities which are not adequate in this country. They are also to like help with community participation and engagement. So another factor is for case management. That's when you identify a case, be able to manage adequately, infectious control, and even education, national orientation. Thank you.
Okay. Also, Oluwafemi, now the NCDC has said, like I mentioned earlier, that the disease spreads easily among people through direct contact with infected persons, droplets from coughing or sneezing, and contact with contaminated clothing and objects. So, isn't there a need for quarantine measures at this point?
Yes. So, talking about preventive measures for diphtheria, preventive measures generally can be divided into primary prevention and secondary prevention. So, primary prevention is when you are trying to prevent the acquisition of the organism. You don't want anybody to acquire the organism. So then that is done through vaccination. So vaccination can be done during childhood, or now that they are trying to do something they call reactive vaccination, where due to the outbreak, you want to identify those that have not been vaccinated and vaccinate so that they don't come in contact with the organism. So secondary vaccination is like managing cases that have been identified and preventing the spread. And this can be done through various ways. So when you identify a case, the best thing is to maybe isolate, then treat adequately. So you either give the diphtheria antitoxin, you can give diphtheria antitoxin and antibiotics based on susceptibility to the organism, to the yes, based on susceptibility to the antibiotic. So what they do after that is for case management. So there are other measures to be taken by the community and health workers in general. Measures like the standard precautions like hand washing, clean your environment or things around you, wear personal protective equipment, ensure that your children they get vaccinated. Like take them to the vaccination center, let them be vaccinated against uh, um, diphtheria. So if we are able to take some of those measures in a way, we're able to curtail the spread of this organism.
All right. I think this is going to be my last question. Now, earlier in the month, the new Minister for Health mentioned, that's Dr. Ali Pate, said that they want to start taking the health sector more seriously, not like they haven't been prioritizing it before, but now they're going to be looking into equipment and means to fight these kind of bacteria that we're talking about. But at the moment, Oluwafemi, in your own opinion, do you think that we have the right equipment to fight this infection?
Okay, I'll address that in two ways. This is an outbreak. I think the first outbreak was recorded in 2011, then 2022, then 20 January to April 2023. Now we have the recent one between June and September. So based on equipment for outbreak, if you look at the modalities of treatment for this condition, they are not readily available. For example, the diphtheria antitoxin, and you have very few manufacturers. This is coming from WHO. The only thing that is readily available, which we have not done well, is vaccination. How to prevent this organism. So only about 42% or about 50% of our of people affected are actually vaccinated, and this is like the statistics from the survey Nigerian government carried out a few years ago. So for now, I don't think we have the equipment that can go around to detect this thing. But based on the new commitment by the federal government, I think they should be able to improve on availability of supplies, equipment, training of health workers, and other logistics, so that this condition can be prevented.
All right, Oluwafemi, thank you so much for joining us on the show and giving your input. Senior Registrar, Department of Internal Medicine, Lagos State University Teaching Hospital, Nigeria. Thank you once again for joining us on the program.
Thank you very much.
It's a pleasure. All right, diphtheria, like he said, is not just a children problem, although it's more prevalent in children. But at this point, the onus is on everyone to stay precautious and careful because the bacteria is spreading like wildfire. And as much as the government is trying to do their best and their bit to tackle the infection and curb the spread, it is also left for people to be more careful. Be careful who you talk to, be careful where you stay, who you stay around, and always get yourself checked. Thank you so much for joining us on Village Square Africa today. It's been a very insightful and informative episode of VSA. My name is Blessings Mosugu. See you again on another episode of the program. Thanks for watching.